internal rotation, passive stretch, and pails and rails. Hands behind, both legs in front. Take one leg over the top of the other. Allow the weight to pull the bottom leg towards the floor. We want to bypass the tissue on the top of the leg and feel a stretch on the posterior capsule underneath. In fact, if you take your hand, you can feel the bone under here. It's a very distinctive stretch and sensation. It doesn't feel like the hamstring stretch. It feels more like a dull ache. As you go in, as you reach your end range, you will be tempted to lift the hips. I want you to find the stretch and resist that temptation, and if anything, rotate away from the direction of the leg, this way. For your passive stretch, as always, you will try and hold for 2 minutes, both at the beginning and in between pails and rails efforts. While you're doing passive stretch, deep breaths in through the nose and out through the nose. The leg on stretch is the fixed point. So in order to increase or better find a position, you will have to move your body in relation to that hip capsule or to the leg. That can come in the form of sticking your bum out, lifting your chest, or rotating away or in the opposite direction of the leg. Any adjustments you make should affect the joint in question, not increase tension elsewhere in the body. For pails and rails, your pails movement in this position will be to take air into the abdomen, brace, and push against the resistance of the top leg. If your leg wasn't there, it would look like this. Because it is a rotational movement, you want to imagine your femur rotating in the hip socket rather than just moving your leg outwards. It is a rotational movement. You can think of pushing your knee into the resistance or your foot into the floor. For rails, remove the leg, stay at the range, and try and actively pull or rotate the knee towards the floor. We want to connect with this top tissue, so you can also imagine your foot trying to raise off the floor. It may also be helpful to rotate against that direction with your torso.